You're, have my name there, but that's what I wish you would.
Say it again.
I have my name there.
Oh, okay.
Yeah. It was? I am.
They come here.
Okay.
There'll be a hearing, so he needs to take one from the crowd and then take one from Twitter.
Good morning. Good morning. Good morning, CADCA. And welcome to your exciting town hall meeting. We trust that you've been enjoying the conference, that the workshops have been spectacular, and the new friends that you've met will be lasting. I'm Karima Abdullah, the Vice President for Training and Youth Programs at the Community Anti-Drug Coalitions of America, and excited to be with each of you today. I hope that you have some great questions already thought out, or as you're hearing from our great panelists, that you'll come up with some. We will have opportunities at this town hall meeting to have your questions answered. Our theme this morning is the future for health and safety in our communities. And we have just the experts here to help us navigate the future and map the way and have us understand what the clear path is to increase health, safety, and have drug-free communities be an ongoing part of our everyday lives. This year, I get to have some super support in making sure that your experience is one that will be quite memorable. We are honored to have in our midst Jim Vance, NBC News 4 anchorman. Now, where are my people from Philadelphia out there? I know you're there. We have Pennsylvanians in the audience. Jim actually began his career in Philadelphia as a reporter for the Philadelphia Independent newspaper and a part-time reporter for the radio station WHAT-AM, while he also taught in the public school system, a man around town. He's also had an opportunity to have a career that spans 42 years as an anchor person at NBC News 4. He's gained increasing recognition and prominence in the metropolitan Washington area, and currently he anchors Channel 4 News Live at 6 p.m. and 11 p.m. And I know Washingtonians and folks in the metro area are tuned in at those times to catch the hottest news in town. What I really like about Jim Vance is that he understands who we are and understands our issues and the meaning of giving back to the community. And as such, he's been recognized by many organizations. He's received the National Association of Black Journalists Hall of Fame recognition, as a member of the Civil Circle of the Washington area chapter of the National Academy of Television Arts and Sciences, and he's won the Ted Yates Award for Outstanding Community Service, something that's near and dear to all of us. But just for a moment, I'm going to give you something hot off the press. In his continued efforts to make sure he's making a difference and keeping his eye and attention on what really matters, he yesterday received significant recognition at the annual Media Appreciation Luncheon, where they celebrated his 42 years of outstanding anchoring in our capital city. Congratulations, Jim, on being recognized for giving back to our community. And this one's really cute. I like this. Radio 1 DC honored Vance yesterday, but also Sisters for Sisters Network said that Jim was such an icon that they had to induct him as a brother. So let's give it up for Brother Jim Vance.
I'm going to have her do every introduction for everything that I ever do. That was awesome. Good morning, ladies and gentlemen. Welcome here, and thank you for inviting me to participate in this meaningful effort here this morning. Let me begin by noting, because it is also true, and I certainly can't and won't ignore it, that 25 years ago, actually, anywhere beyond 24 years and 4 months, I would not have been here, and you would not have wanted me here. Because at that time, I was deep in the throes of a cocaine addiction that was about to kill me. I mention that because it's important. I went to treatment 3 times over the course of 5 years before I got clean in '87. Finally did get, well, thank you, but finally did so the old-fashioned way from 12-step rooms. But the point of it all, and the reason I bring this up, is because much has changed in those 24 years, and I am grateful for that, and I am sure that all of you are and should be, because you have a lot to do with the fact of that change. 24 years ago, there was no CADCA, or 25 years ago. 25 years ago, the resources that are available to so many people who suffer today were not available. 24, 25 years ago, the government was nowhere near as involved or aware as it is today. None of us were. 25 years ago, the resources that are available today were not available to no fewer people who were suffering at that time. Much has changed. Number one, I have changed because I'm glad you want me here today, and I am happy to be here with you, but I am also thrilled that an awful lot of people who are suffering today, as they were 25 years ago, have resources and avenues open and available to them that were not available some time ago, because so many of us have finally come to understand and to conclude that this is a national issue, a health issue, a critical issue that all of us have to deal with. Years ago, many of us, thank you, were reluctant even to seek treatment because of the shame and the stigma that was associated with addiction. That stigma is not gone and still exists today. But beyond that is the fact of all of the preventive efforts that are available today for millions of Americans that did not exist as recently as a quarter of a century ago. It's a whole lot easier, isn't it, to deal with a problem before it becomes a problem than afterwards with all the expenses that come with that. Anyway, having said all of that, I am really happy to be here today, as I am anywhere on any day when people are serious about the business of dealing with addiction in these United States of America. And that addiction, by the way, I'm not talking just about hard drugs, the cocaine and the heroin and those kinds of things, but also alcohol and tobacco and all the other substances that are out there shortening and ruining lives. What you folks are doing here today, I hope you recognize it and realize it, is you are saving lives and preserving families. And I think that that ought to be recognized and celebrated. I am looking forward to what's going to happen here today. And I am looking forward to learning something. I am looking forward to lively discussion and participation by each and every one of you. But here's something you got to know. When you get up on that microphone, don't act like it's the first time you've ever been in front of a microphone. It's like all these fools after they make a touchdown and do all them weird things they got to do. Suckers been making touchdowns since they were 9 years old, and then they get on national TV and act like it's the first time they ever crossed the goal line. That's silly. Don't be silly. If you got a question, ask your question, because what you want is an answer, not microphone time. Am I right? So let's work this like we're adults here today. I want to introduce our panel. They are some wonderful and distinguished people. I've had the opportunity to meet a few of them just a couple of minutes ago, and I'm happy to be here with them today, and I'm sure that you will be happy that they are here as well. I will go in no particular order, but let's begin with Michelle Leonhardt. She is the administrator of the Drug Enforcement Administration. Hold your applause, if you will, to the end. Pamela Hyde is the administrator of the Substance Abuse and Mental Health Services Administration. Kevin Jennings is with us. He is the Assistant Deputy Secretary from the Department of Education. And Dennis Greenhouse is the Director of the Community Capacity Development Office with the Office of Justice Programs from the Justice Department. Can we welcome them now, please? Thank you, one and all. These are folks who know what they're talking about, but more than that, they are committed to the jobs that they perform on a daily basis, and I am looking forward to hearing what they have to present for us today. We are going to begin, if it's okay with you, with a few questions that I would like to ask these folks to kind of set the stage for what we want to get through here today. They are going to have a specific amount of time to answer each question, and then we are going to open it up to all of you, and we will get to the meat of this particular event at that particular time. You've been told about the Twitter thing, right? I hope you understand it, because I'm still clueless. But what I will do is I will read your Twitters, because I can read. I'll read your Twitters here on this monitor, and from time to time, I'm not sure why you'd want to use a machine to ask a question of Mr. Greenhouse when he's right here in front of you. But if that's what you want to do, and that's how you roll, feel free to do that, because we're prepared to handle this new technology, all right? Let us begin with this query. What is new? What is innovative? What are new and or innovative approaches that are being adopted by your institute or agency that will have the greatest impact on our communities? Let me state that again. The first question will be, what new or innovative approaches are being adopted by your institute or agency that will have the greatest impact on our communities? Ms. Leonhardt, would you care to begin that?
Sure. Good morning. It's my privilege to be here. I was on this stage last year in the middle of the snowstorm, and we didn't have a full panel. It was very, very good to wake up this morning and know that we were going to be able to get here okay. But it is a privilege to represent the Drug Enforcement Administration, and actually I'll be the law enforcement representative up here. And too often people think that when we talk about the drug problem that it's just a law enforcement problem, and it isn't. As you know, and as we in law enforcement have learned from each and every one of you, it's a community safety issue, it's a public health issue, it requires all of us. So today, I hope you can learn about what DEA is doing, partnering with you. Jim Vance asked the question, you know, what's new? Well, we learn from looking at drug trends, and we respond to those, and we try to be ahead of them. And the drug trend that I guess keeps me up at night right now is prescription drugs. And all of us, I mentioned it last year, I mentioned it the year before, we have been mobilizing and trying to get the word out, and it's prevention, doing what we can to send the right messages and educate the public. It's treatment, it's recovery, but it's also law enforcement. And this year we needed to do more, and we took a leadership role in take-backs. We learned from you, whether it was in New Jersey with the take-back they did a year ago, October, or if it was, you know, whether it was Oregon or Washington or some of the states that had their own take-back initiatives. We decided one of the things new and innovative we could do is coordinate for the first time a national take-back on one day where we could all come together in communities across the country. We could educate and we could get people to take the prescription drugs out of their medicine cabinets and bring them in for safe disposal. It was such a success, and we took the elements that you showed us in your own community take-backs. We took the best of those, and we were able to combine it and do a national take-back on September 25th. The turnout was unbelievable. Who would have thought that we could have had 4,000 locations simultaneously? We had college campuses, we had schools, we had community centers, shopping centers, you name it, we had it covered. And we had it covered because we had 3,000 organizations. Many of you in this room were the movers and shakers on that. We were able to have the one-day take-back and collect 121 tons of pills. Who could have ever imagined? That's 121 tons of pills that are not sitting around for our teens to be abusing and for our elderly to by mistake, be using. So that was a success, and we can do more. We are planning with you another take back for April 30th of this year, and we know the turnout will be just as successful. Another area is drug endangered children, and I talked about that last year. We've learned from you, and we've learned from our law enforcement partners that we need to do more to make sure that the kids affected by drug abuse, drug use in the homes are taken care of, because 59% of those physically abused children are more likely to be arrested as juveniles, 28% more likely to be arrested as an adult, and on and on and on. And I'm proud to say the Department of Justice has taken a leadership role. The Deputy Attorney General himself has developed and is leading a task force, and we're doing that with you. And then thirdly, getting the message out And we've done that by upgrading and improving 2 websites we have at DEA. Just Think Twice, which is for teens, and Get Smart About Drugs, which is for you and for parents. So working together with you, looking at the trends, being smart about each of us playing our roles. It's only doing it together that we're going to succeed, and we've had many, many successes, but we have much more to do. Thank you.
Thank you, Ms. Leonhardt. Ms. Pamela Hyde, the question: what newer innovative approaches being adopted by your institute or agency will have the greatest impact on communities? Ms. Hyde?
Thank you, Jim. And it's great to be up here with all these terrific partners, because partnership and collaboration, I think, is a key theme for all of us right now. I think it goes without saying, some of you have heard me speak a couple different times in the last week already, and you know that SAMHSA is going through a number of changes, all of which have a positive impact on you. We are focusing very hard. These are, frankly, tough times, and tough times call for tough choices, and we are doing that and trying to focus. But the way that we are trying to focus, I think, for you, is we're trying very hard to think about the way the people come to us, not the way the money comes to us. And the point of that is sometimes we focus so much on a disease or a condition that we forget that people come to us with multiple diseases, multiple conditions, multiple social determinants, multiple cultural attitudes about drug use and help seeking and other kinds of behaviors, bullying and other things. And we are trying very hard to think less about a particular funding stream and more about how we can make options available to states and to communities to address the people and the cultures and the norms and the enforcement issues that you see in your communities as needing that effort. We have identified, I've said this many times, prevention is our #1 strategic initiative. So to the extent that we are trying from the federal level to give you a platform on which to say prevention is, in fact, the name of the game and what we need to be doing, we're trying to work on that. We are also, frankly, trying to be a little different in the way we hold ourselves accountable. And that means also in the way that we hold our states accountable that we fund and our communities accountable and other things. And accountability doesn't mean just that we want to be on people's backs trying to make sure that money's used in a certain way. What we're trying to do is collectively aim higher. We are trying to collectively say, what are we holding ourselves out to do? If we are, Kevin and I were just yesterday at the National Suicide Prevention Action Alliance. We had a fascinating conversation about what are we trying to do? Are we trying to reduce suicide by a certain percentage in 5 years? Or are we really aiming high to say no one in our country dies from suicide? So we're trying to think about that on our own behalf and on your behalf, and trying to raise our commitment to that. We're also trying to focus very explicitly on things we think that we as SAMHSA can make a difference about. So, for example, within our prevention initiative, we have 4 major things that we're focusing on: preventing substance abuse and mental illness, and community coalitions and community work is a major part of that effort. We're working with ONDCP and DOJ and education on a concept called Prevention Prepared Communities, which was in the President's 2011 budget, and we are still committed to going forward. We are trying to look at the way our limited dollars can be used to increase our prevention efforts throughout America, and trying to just see how these short and small dollars can focus on literally showing a difference in the drug use, the number of new initiates every year, the number of kids who are experiencing those things. We're also trying to take a look at, as was already talked about, the prescription drug issue. This is something that all of us are worried about. It is the area where the data shows us that the numbers are going up almost across the board, across gender, age, race, et cetera. So to know that we have 2,500 or so new initiates every year, and adolescents alone at misusing substances that are prescribed is a huge issue for us and for our
1 minute.
communities. So we also are in that initiative trying to look at suicide. And as some of you heard me say the other day, the connection between suicide and alcohol is very high. This connection to suicide and substance abuse is equally high. This is something we can and must change in our country. And then, frankly, we also are looking at the issue of tobacco, because 44% of the cigarettes in our country are smoked by people with substance abuse and mental illness diagnoses. That means there is a connection there that we have not yet done the right thing about. So there's lots of stuff going on in SAMHSA. I urge you to watch what's happening over the next couple of weeks. Budgets, block grant applications, all kinds of things, strategic initiative paper coming out, and see all the new opportunities there to look and think a different way.
Thank you, Ms. Hyde. Kevin Jennings, with the Department of Education.
First of all, good morning. I want to stop for a second and thank Jim Vance for his courage in being out of the closet as a person in recovery. Working on recovery issues is my #1 priority in terms of the drug-free side of my safe and drug-free title. And one of the things that has just become more and more apparent to me every single day I work on this is that the stigma around this issue is the biggest enemy we're fighting. And the way that we overcome that stigma is when people that we all admire and love, and I spend every night with at about 11 o'clock, come out of the closet to us and say, I'm a person in recovery. So, Jim, thank you. I was reminiscing with my friend Michelle Lipinski, who runs North Shore Recovery High School. Michelle, you and your students out there somewhere? You over there? There you are. Excellent. About 2 years ago, I walked into this building. It was my first major event as the Assistant Deputy Secretary for Safe and Drug-Free Schools, and it was not a happy time. Congress, as you might recall, the primary funding mechanism out of our office used to be what was called a formula grant, which went to states and local districts, which provided funding for drug and alcohol education based on enrollment. Congress didn't like that program much, and it had just been eliminated right when I took this job. So my office had sustained a 40% budget cut. And the question was, how were we going to deal with this going forward? And we decided that we needed to do two things very differently going forward. First of all, we needed to listen to the kids. That one of the things that has been missing is that, ironically, we assess the heck out of kids in education. We're giving them standardized tests so they come out their ears, but we never ask them what they actually think of their schools. And secondly, we need to direct resources to the places where the kids tell us there are problems. So we developed a new grant program which we launched last year called Safe and Supportive Schools, which are allowing 11 states, including the state of Maryland, who are piloting it, to utilize student surveys which include issues of drug and alcohol use and other issues such as respect for diversity, sense of belonging, the wellness environment, to determine which schools have the biggest problems and to direct grant dollars to the schools where the kids are saying, we have a problem here. And in addition, the results of this scoring system must be made public so that everyone in the community will know where the problems are. We're very excited about this new approach because we think it'll do a couple of things. First of all, the real experts about what's going on are the kids, not the adults. And this marks the first time in federal education policy history that we've ever actually asked the kids what they think about their schools and what is actually going on in their schools. Secondly, we think by pinpointing resources and getting them to the schools with the biggest problems, we can actually give them enough resources to do something about their problems. The problem with our old grant program, in that it was a formula grant, was you could have two schools that each had 2,000 students and they each got the same amount of money. One of them could have a relatively small problem. One could have had a massive problem. This new approach will allow us to put the bulk of the money in the school with the real problem. So we're very excited about Safe and Supportive Schools, and we've asked Congress for a 140% increase in funding for this so that any state that wants to do this going forward will be able to. I'm very happy to tell you that 31 states applied last year, so there is a strong, strong interest by state departments of education of using this new approach. The second thing I want to emphasize really quickly is what I started with, the emphasis on the issue of recovery, which I think we need to start thinking of in a new way. Recovery is a form of prevention. It's relapse prevention. And it needs to be given the same amount of focus and support as our other forms of prevention. This year, and our senior policy advisor, Norris Dickert, is sitting right over there. If you stand, Norris, so if people would know who you are. Norris is leading our efforts in this regard, and we will be starting a new priority within our college campuses program for enabling state university systems to set up flagship campuses that have recovery programs modeled after places like Texas Tech and Rutgers. And we'll also be incorporating into our GRAW grants to reduce alcohol abuse, which targets secondary schools, a priority for systems that incorporate recovery programming as part of their overall effort to reduce alcohol abuse. So we hope that this new focus on recovery will, I think there's sort of three legs, as we all know. There's prevention, there's treatment, and there's recovery, and recovery has always been the red-headed stepchild, if you will, of those three legs. I think it's time that we elevate it, and I think it's time that we give it the same level of focus and attention. So in terms of what we're focusing on, we're trying a comprehensive approach that listens to students, that targets resources to the places where they're most needed, and that supports people in recovery. And I thank you as the people who are on the front lines fighting this battle every day. Our job here in Washington is to support you, and I thank you for inviting us here to tell you what we're up to.
Thank you. Thank you, Mr. Jennings. From the Community Capacity Development Office, Office of Justice Programs, Dennis Greenhouse.
Thank you, Jim. First, let me say that as one of the Justice Department's primary grant-making components, the Office of Justice Programs need partners like you who really impact communities. And under Assistant Attorney General Laurie Robinson, our commitment to partnerships in the field has been restored and actually redoubled. And I'll briefly highlight just a few of our programs that have the greatest potential to really change our communities. All of them are supported at the highest levels of this administration, and none of them, though, will work without your support. Now, normally, when I talk, I speak about the Community Capacity Development Office, but today I am going to speak about the other components and some of their programs as well. So, first, the Attorney General launched a program last year that can change the way we respond to children exposed to violence. It's called Defending Childhood. It focuses on helping children who are victims and witnesses of violence and includes prevention, intervention, awareness, and research components. OJP plays a central role in defending childhood. We're supporting the development of demonstration sites that will use evidence-based interventions, and we also supported the research that formed the underpinning for this effort, and will continue to conduct research to inform its growth. As you have no doubt seen firsthand, children who are exposed to violence face a wide range of negative outcomes, including an increased likelihood of alcohol and drug abuse. Defending Childhood is an unprecedented collaborative effort to help these children, to make sure that none of our young citizens fall through the cracks. BCJI, the President's 2011 budget proposes to replace my office's Weed and Seed strategy with an initiative called the Burn Criminal Justice Innovation Program, or BCJI. BCJI will directly address public safety issues including violence, gangs, and illegal drugs, and will combine prevention, intervention, enforcement, and reentry efforts. BCJI will build on the documented successes of Weed and Seed. In the 2010 National Evaluation of Weed and Seed, it showed that substantial decreases in certain types of crime, as well as fear of crime, and important improvements in relationships with police and resident participation. BCJI will also include some meaningful enhancements. It will feature a greater focus on place-based and evidence-based practices. It will also allow for greater flexibility to support innovative partnerships with other federal, state, local, and tribal agencies. In several cases, the program will work with Education's Promised Neighborhoods, as well as HUD's Choice Neighborhoods. Currently, this program is pending congressional action on appropriations, and we remain hopeful that the enacted appropriations will support the administration's priorities. And finally, I'll just mention our support for both adult and juvenile drug courts. I know many of you have seen the results of drug courts firsthand. Now a growing body of research is validating the personal victories we've all witnessed. Drug courts can be an effective method of reducing recidivism and future drug use. OJP works with state, local, and tribal governments to develop and implement drug courts to help nonviolent substance abusing offenders. In FY 2012, the Bureau of Justice Assistance provided $45 million in discretionary drug court grants. This included funding to support ongoing training and technical assistance for drug court practitioners, as well as support for establishing new drug courts. BJA also supports the National Drug Court Resource Center, an online information clearinghouse. Our Office of Juvenile Justice and Delinquency Prevention is partnering with other agencies and organizations to expand the use of juvenile drug courts that follow the Reclaiming Futures model. This model uses community partnerships to help teens with substance abuse problems get more treatment, better treatment, and help beyond treatment. In FY 2010, OJJDP provided more than $1 million for this initiative. OJJDP also worked with the Center for Substance Abuse Treatment to support 23 family court drug programs.
1 minute.
To expand our understanding of drug courts, the National Institute of Justice funded a 5-year comprehensive study of drug courts. The preliminary findings are promising. For instance, drug court participants reported less criminal activity both 6 and 18 months after their admission than a comparison group. They also reported less drug use or possession than the comparison group. Finally, BJA and NIJ are also collaborating on a research to practice initiative for adult drug court practitioners. This will help translate our important research into cost-effective policies and practices. These are only a few of the examples of the many that OJP offers. I suggest that you contact us and go to our website, www.ojp.gov, for more information about programs, projects, and funding.
Thank you, Mr. Greenhouse. A couple more questions we want to ask our panelists. We're going to make them talk fast because we're only going to give them 3 minutes to answer each of these following questions. The first one, and Ms. Leonhardt, I'll begin with you once again, if you don't mind. Curious to know how community coalitions, such as these folks here today, are informing your public health and/or safety priorities. Ms. Leonhardt?
Thank you, Jim. Well, first of all, we at DEA are partnered with you all across the country. We have offices in over 200 cities across the United States. So not only are you personally informing me, for instance, just a few days ago, I sat down with Judy Cushing from the Oregon Partnership, learned about what they're doing. But the same thing is happening across the country with you and your coalition sitting down with our DEA agents and our DEA SACs and our DEA ASACs. We learn from you, and I think I can come up with three areas that we really give you the credit on for educating us. Number one would be prescription drug abuse and all that you've done to get the message out, all that you have done to educate law enforcement on those issues. And more recently, I learned from you first about spice and K2, and now more recently about bath salts that are going to be a problem for all of us. And because you educated DEA, we were able to move and ask for emergency scheduling of 5 of those drugs that were showing up in your communities and being marketed as spice and K2. It would have happened a lot later if we weren't partnered together, if DEA wasn't listening to you, and if we didn't have this dialogue back and forth. So thank you. Thank you for that. And to me, the most important one is thank you for your leadership on the marijuana issue. What you have done, especially in those medical marijuana states, to open eyes to what really is happening with many of those dispensaries, what you have done to attempt to educate people when all the messages that they're seeing on television and they're reading and they're hearing from their peers has really turned the tide, not in a good way for us. We see increases. After years of decreases in every illegal drug category, what started to spike? Marijuana use by our teens, and that's because of the mixed messages. But it's you, the community coalitions, and the people working in prevention and treatment that are out there spreading the word so that our young people do know marijuana is dangerous. So I want to thank you in those areas. And I also want to thank you for the outstanding work that you have done over the years in getting the message out about methamphetamine. I mean, we had very good successes over the past 5 or 6 years. Especially, we saw decreases in labs. We saw more people going to treatment. And I'm worried again. And I know that you have stepped up to start re-educating people on what an insidious drug methamphetamine is. And those lab numbers, just in the last 2 years, have spiked again. They're up 92%. So we all have more to do, but you have taken a leadership role in that. You have educated DEA. We have partnered with you in ways we've never partnered before, and we want to thank you.
Thank you, Ms. Leonhardt. Pamela Hyde.
Thanks. And all of you have led us to redefine our fundamental mission. Our mission, the way we now talk about it, is to reduce the impact of substance abuse and mental illness on America's communities. And it's because we understand from you, from all the work that you've done, and as we watch the grants that we make and the kind of data that comes back to us from the kind of impact that you have, is that communities and community coalitions are the place where the work of that effort gets done. So you have had a profound influence on us in that way. We also have heard from all of you some pretty fundamental things. One is that it's sometimes hard to get our grants and the paperwork's tough, and in some communities, like tribal communities, for example, that the requirements are really hard. And so we have taken a lot of that effort and have totally thought about how we redo and how we rethink our grant-making process. And part of what's coming out of that for us, which hopefully will be helpful to you, is a little bit about what I said earlier, which is some of you are coming to us and saying, but you're asking us to apply for $1 over here that's focused on this thing, and $1 that's over here that's focused on that thing, and $1 over here focused on something else. But when the kids come to us, or the people come to us, or when we go to the schools, or when we go to the families or the courts, all of those things are there. So how do we look at braiding our funding? How do we look at partnerships within SAMHSA, as well as with our partner agencies?
1 minute.
And you have really helped us to think about how to do that differently. Next week when our budget comes out, you will see some new opportunities about that. And let me give you one example that we're actually, frankly, really struggling with, which is how do we, with the way the dollars come down, because we do a lot of work with DOJ on this, for drug courts and mental health courts separately, and then there's people doing veterans courts, and then there are judges out there saying to us, but I got a veteran who's drinking, who's homeless, and who has depression or schizophrenia or PTSD. How do I deal with that human being? So we're trying to think about these in terms of dollars. We're also trying to think about what you tell us about the kinds of things you need to influence. And sometimes the kinds of things you need to influence in order to do your work are policy issues that communities don't control, states do. So how do we engage states and hold them accountable to some of those policy changes, like decisions about marijuana, like decisions about enforcement and other kinds of things? So we are also trying to work on those issues with and for you. And I could go on, but I know probably my time is up. So.
Thank you, Ms. Hyde. Kevin Jennings.
One of the mistakes we have made in schools over the years is treating schools as if they are islands. Schools are not islands. They are embedded in communities, and the most effective approaches are ones where there are strong school-community partnerships. I think one of the most great examples of that actually is a joint program between the 3 agencies you're seeing represented here called Safe Schools, Healthy Students, which is funded and administered jointly by our agencies and requires the same level of collaboration at the local level between law enforcement, schools, substance abuse and mental health, child welfare, and community organizations to tackle problems. We've seen the similar thing happen on college campuses. We have a new initiative tackling the issue of drinking on college campuses. There are many, many drugs that are being used on college campuses, but the number one is alcohol. And the fact is, kids who go to college are more likely to binge drink and more likely to have alcohol problems than kids that don't. So colleges are not helping, they are hurting. The most effective approaches to reducing alcohol use on college campuses have involved engaging the community and community partners. The campuses that have tried to go it alone have found that they cannot be effective. So one of the things that we have learned is that if we want to improve things in schools or we want to improve things on higher education campuses, we must engage with the community. And you'll see that as a priority in everything we're doing going forward. Within the new Safe and Supportive School grants, we are prioritizing partnerships between non-governmental organizations, community partners, and school systems to tackle the problems that the kids are saying are the problems. Because quite honestly, as a former history teacher, I could tell you, nobody trained me on issues like substance use. That is not my expertise. The expertise that exists in the community is what the schools need to leverage in order to solve these problems. So the most effective approaches are ones where the schools recognize that they're embedded in communities and they are partnering with communities to solve the problems, because the kids are not just students, they are members of the community, and we cannot divorce schools somehow from that reality.
Thank you, Mr. Jennings. Dennis Greenhouse.
Well, at OJP, pretty much everything we do is informed by our partners in the community. And our partners include criminal and juvenile justice and victim assistance practitioners, professional organizations, community organizations, and state, local, and tribal policymakers. In the last couple of years, we've increased our focus on holding listening sessions and small group meetings with practitioners, researchers, and experts. And all of OJP's bureaus and offices have held these sessions. And we're working to integrate what we hear into actually what we do. For example, while launching Defending Childhood, we held several small group meetings with national experts. We also, just a few weeks ago, hosted the grantees in Washington to get their input on how this program should work at a local level. Weed and Seed, of course, has always been based on community partnerships and has evolved based on community feedback, and BCJI will continue that tradition. CCDO has relied heavily on local coalition input to inform policies, programs, training, and technical assistance provisions, and capacity building at the community level. And drug courts are, I think, an amazing example of an initiative that actually came from the field, that we have studied, evaluated, and are now working to take to scale. And we're not just open to feedback and ideas, we're ready and willing to act on them. And one initiative that I didn't mention earlier, but it also is indicative of our focus on working together, is our OJP Evidence-Wide Integration Initiative, which we call E2I. E2I is a direct response to practitioners' needs for research they can actually use. The primary goal of E2I is to give practitioners and policymakers better tools to understand, access, and integrate evidence into what they do every day. And as part of this effort, we've established evidence integration teams, and they are busy developing principles for practice that we'll share with the field. And the first two teams focused on children's exposure to violence and gangs, and they're finalizing their reports now.
Thank you, Mr. Greenhouse. One final thing here to kind of set the stage before we open this up to all of you and your questions. We're curious to know, from where you folks sit, what are the most pressing public health or safety concerns that have been identified by your agency or department, and exactly what it is, how can these community coalitions help you address those problems? Again, Ms. Leonhardt, we'll begin with you.
Sure. We learned from you that the more the community knows about the dangers of the more we can use our resources to target those that are bringing the drugs to your communities, those that are exposing your kids to drugs. So I think it's important for DEA to follow the lead from you, and that's what we have done. have talked about prescription drugs. I'll talk about it again. You know, it is bothersome that every day 7,000 Americans abuse prescription drugs for the first time. So we have an epidemic there. So you've told us about it, and we have changed a number of our enforcement initiatives and strategies to address that. For instance, the pill mills, especially in Florida. You know, it used to be that people would take a junket to Atlantic City to gamble. Well, now we have people taking junkets to South Florida to go grab pills. And that's unacceptable. We learned about it from you. Marijuana use, like I said, it's hard to separate medical marijuana issues with drug legalization issues. Those are very, very serious because those are the messages that our kids are getting. And as the president has said, legalization is a non-starter. We have learned from you that it is all about messaging. And when we stop sending the right messages to kids, they start using drugs. So we have learned from you, and we are doing what we can to put material on websites. We're doing what we can using the Take Back. The best byproduct of that Take Back initiative was the messaging that we were able to do to educate people on the dangers of prescription drugs. And we were flooded with calls and with letters and with emails of people saying, I didn't know I was a part of the problem. You helped us in that regard. Increase in meth labs, like I mentioned, up over 90%. You have shown us that, for instance, in Oregon, in Mississippi, by being very active and being active not only with your community but with your politicians, we have seen in Oregon a drop in meth labs by 90% and in Mississippi by 68% because you were active. You said we cannot tolerate this meth lab problem in our communities, and you changed the laws. You made pseudoephedrine prescription only. And the evidence is right here by these reductions. And then finally, we all should be concerned about what's happening in Mexico and on our southwest border. And so we are helping your communities, helping your law enforcement officers realize the connections between those Mexican cartels to those that are transporting, those that are distributing drugs in your communities, and that is a major priority for us. And let me summarize by basically saying our focus is on those Mexican cartels, but all together here, coalitions, treatment, prevention, recovery people, and law enforcement, we are the biggest cartel, and we can defeat the drug problems we have in this country.
All right. Ms. Leonhardt, thank you. Ms. Hyde, Pamela?
This is the question where I think all of us get to preach a little because we all have strong feelings about it. And it may be one where I think I have to take off my federal hat and make a disclaimer about personal comments. But, I think if you think about it from my point of view, I think our biggest problem, I'm not sure that that's exactly the way the question was phrased, is public attitudes, if I can just phrase it that way. And it's everything from the expectation that in order to turn 18 and become a man or woman, that getting to drink, or maybe 21 these days, is a rite of passage to adulthood, or the idea that getting into a car after a party where drugs and alcohol has been used, and drinking and driving and drugging and driving is the right thing to do. Or just the idea, if you look at the constant messages on TV about what pill you should take for this and what pill you should take for that and what pill you should take for this. And, as long as, my staff have heard me say this, but as long as we have a capitalistic approach to something that is a public health problem, we have a problem. And I don't know what to do about that. And frankly, as long as we can have people legally walking around, Kevin, this one is for you, legally walking around with enough bullets to kill multiple people in 15 seconds, we have a problem, a public attitude problem.
1 minute.
And we at SAMHSA have been thinking about how we can help to call on America to have a public dialogue about the role of behavioral health in our communities. Because it is not just the attitudes about drugs or the attitudes or public messages about drinking and driving or the public messages about anything that we all try to change the norms about, or gun control, but it's also just the notion that people think of recovery as maybe not being possible, or think of addiction as something to be not discussed, or think of people with mental illness as not wanting to say they have that because it's not okay to be a person with mental illness or an addiction. We have a long way to go about the norms in our country and the prejudice and the discrimination about behavioral health issues. And until behavioral health is seen as a legitimate and common and regular part of our health delivery system, I think we have an issue. And I think that is our biggest and most difficult public safety and health issue.
All right. Pamela High, thank you. Mr. Jennings.
I suppose I can't get away with saying ditto. But Pam nailed everything I would have said. I'm going to revisit, though, a little bit the issue of stigma, and I want to do it in very personal terms, because I do think that is a lot of the societal attitudes Pam is referencing. A lot of it is still attached to the issues of shame and stigma around issues such as mental illness or substance use. I'll use two very personal examples. I wrote a memoir several years ago called Mama's Boy, Preacher's Son, in which I was very open about the fact that I had substance use challenges when I was a young person. This was then used by news media to say I was unqualified for this job. The lesson for that is, if you are a person in recovery, keep it to yourself. Don't talk about any challenges you've had, because it will be used against you. Secondly, I was in Ohio, Pam's old stomping grounds, about a year ago, and it was Mental Health Awareness Day. It just so happened on the day I was there, they said, could you also speak at this rally at the Capitol? And I was there, and a young woman gave a very moving testimony about her own mental illness, her own suicide attempt, and it was incredibly moving. And I thought, here I am, a senior administration official, and I turned to my colleague from the department, and I said, I'm going to go up there and talk about the fact that I have depression and that I take medication for it and that I am a suicide survivor. And I was told by this fellow senior official, do not do that. She said to me, do not go up there and divulge that kind of information publicly. And I looked at her in total shock, and I said, that's the point of this rally, is that we're not supposed to be ashamed about these things. And I want this young 17-year-old girl to understand that, and I love the phrase that Pam's office often uses, recovery is real. That you can struggle with these issues as a young person, as I did, and go on to have a great adult life and great professional success.
1 minute.
And so I think until we no one ever tells me not to tell you that I take Plavix for heart disease. You know, there's no enormous shame around the fact that I have clotting issues. The fact of the matter is that we do need to start thinking of these issues. You know, and I say this with all due respect as a son of a minister myself, we still tend to view these as moral failings rather than health problems. That if you have an addiction or you have a mental illness, it's because there's something wrong with you and you are somehow weak and you have failed and you are a bad person. Michelle was telling me this morning that one of her students talked to her about using it, said, I know I'm a bad person. You're not a bad person. You have a health challenge. And until we get America to start thinking of these things in that way, we're going to continue to struggle.
Thank you, Mr. Jennings. Dennis Greenhouse.
Well, as Attorney General Holder has pointed out, children's exposure to violence is a serious public health issue. Violence is a disease, and we have to treat the cause, not just the symptoms. While the impact of violence on children is tremendous, the influence multiplies as it ripples through our families and through our communities. And that's why defending childhood is starting with such a decidedly local focus. We have to start from the ground up, from the grassroots, to build outward. And this is the only way we can create real systemic change. Another pressing concern I'd point to is the problem of recidivism and the challenges of prisoner reentry. We have to look today to understand that there are nearly 2.3 million people who are serving time in federal, state, and local prisons at any given time. And more than 95% of them will be released back to their home communities. And too many will be rearrested and reincarcerated. These offenders and their communities are locked in a vicious cycle that makes us all less safe and costs us billions. BCJI will focus on targeted, evidence-based reentry efforts as a way to improve communities and help them break this cycle. OJP has many other programs and projects in both of these areas that continue to grow and evolve to meet these challenges. But there's a common theme. To address recidivism and reentry and combat children's exposure to violence, we have to work together. These, at their base, are community problems and community illnesses. They can't be addressed by the federal government alone. We need your engagement, we need your input, and your help. So again, I encourage you to provide us with your feedback. Visit our websites, apply for our fundings. Thank you again for inviting me, and I look forward to your questions.
Thank you, Mr. Greenhouse. I'm a big boxing fan, and well, I used to be when there were legitimate fights. I don't know what these fools are doing now. But back in the day when there were legitimate contenders and all of that, and there was a good boxing game, y'all remember Mills Lane? He was the referee who, after, you understand, you got your instructions, touch gloves, let's get it on. It's how Mills Lane would introduce the contest. This is not a contest. This is an effort here now to try to understand, try to learn, try to exchange, try to expand our awareness and our knowledge of what each of us, both the agencies here and all of you and your coalitions, can do to help each other towards a common goal. In other words, I would like to hear, or we would like to hear now from you. Your questions. A lot of things have been said here today, a lot of good stuff, I'm happy to say. And I have learned a couple of things. I hope you have as well. And maybe we can learn some more now. There's a microphone over here on my left where there is a gentleman standing, and there's another one right here on my right. I will begin on my left. Would you identify yourself, please, and ask your question? And remember, once again, you are not the star here. It's just your question. I'm only kidding. Come on.
Hello, my name is Colbert Prosper, and I'm affiliated with the Broward County Commission on Substance Abuse and the Broward Youth Coalition. I'm also a CADCA ambassador, and as a CADCA ambassador, we have to complete a capstone project, and I did my capstone on how colleges and universities are combating underage drinking, and I am currently pursuing my master's in college student personnel. My question is, how could the community become involved with underage drinking in colleges and universities?
First of all, fantastic question, and thank you for your work and your leadership, and I was born in Fort Lauderdale. So, first of all, I want to draw your attention to a great resource we've created at the department, the Higher Education Center for Alcohol, Other Drug, and Violence Prevention. You go to higheredcenter.org, HIGHERED center.org. And we have a tremendous amount of resources there for how communities can help colleges address the issue of drinking. Pam kind of swept me away because I thought her remarks were so moving. I was originally planning to answer the question of what the biggest challenge was with a one-word answer: alcohol. Somehow we act like alcohol is different in this country because it happens to be legal for people over 21. The reality is it's the most commonly used substance, and it's the one that is the most deadly in terms of deaths. So I think that we absolutely need to engage the community in recognizing that alcohol is a huge problem, that college breeds drinking and alcoholism, and that it is undermining the president's goal of making us #1 again in the world in terms of college completion. In case you're not aware, we were #1. We were #1 the year I was born in 1963. We today are #10 in the world, and we are dropping. So if we don't turn this around, we are going to have a serious problem as a nation. So I think we need to frame this for people as a community problem, first of all. Secondly, as a completion problem. This is an academic problem. And frankly, I want to say to the provincial people in the audience, you need to learn to speak education. What education people care about is completion of degrees. So approach them with that as your opening line. You have a problem that's going to prevent your kids from graduating. Then they're going to sit up and listen. And we need to use the resources already out there. We have, for instance, at our agency funded for a couple of years now a series of statewide coalitions to attack the issue of college drinking. There are very successful case studies of those efforts on the higheredcenter.org website, as you undoubtedly know from your research. The fact is that we have shown that this works.
Thank you, Mr. Jennings. If we can, we'd love to get as many people as we possibly can, so let's keep our questions and our answers as direct and to the point as we possibly can. On my right now at the microphone, please identify yourself and the question.
My question actually is a follow-up to that, in that I think it's great that students are being surveyed for the student or safe and supportive schools. We have in our state a 30% dropout rate. I know it's a serious concern nationally, and I wonder if those students who have left school are also being surveyed. What we have experienced in our school community partnerships is that many of those students did not leave because they were having academic struggles. They left because they did not feel either safe or supported in the school environment. And yet, what schools tend to do in response to a dropout rate is beef up academic instruction and testing, and those programs are on hard money, and the safe and supportive folks in this room are on soft money that often goes away.
Just a quick thing, Kevin may want to answer that too, but these two questions together, I think a lot of us have programs that have to do with college issues, college suicide, college drinking. Underage drinking is an important goal of our prevention initiative. I am very excited about the fact that there are a group of college presidents who have decided to come together and make the issue of underage drinking and college drinking an issue they personally want to take on. And the reason that's so important is because for a college president to step forward and say, my college has a problem, is very difficult for them. So these guys and ladies have banded together, and the Assistant Secretary for Health, Howard Koh, and myself and a bunch of other folks are working with those college presidents. And I think that issue, or that coalition, of a different sort, is going to have a profound impact on trying to change thoughts, behaviors, attitudes, et cetera, about how colleges think about that issue. So they're not going to approach it just as an academic problem per se, but they're going to try to approach it as a community problem, not both on campus and off campus. So more to come on that.
Over on my left.
Good morning. My name is Carol Miller. I'm from the Adams County Coalition for Youth in Gettysburg, Pennsylvania. My question is, are there any plans to incorporate physicians and practitioners in efforts concerning teen prescription drug abuse, the crimes associated with teen prescription drug abuse? I ask this because I'm a breast cancer survivor and was treated at a prominent Baltimore cancer hospital, and I had to educate my doctors on prescription drug abuse in my community.
We have identified in HHS, we have something called a Behavioral Health Coordinating Council, and part of that is prescription drug abuse. It's actually headed up by FDA and NIDA. So those two, National Institute of Drug Abuse, those two leaders are taking on the issue, and one of the things they're trying to identify is practitioners and what they need to know about prescribing practices and how it has an impact. And FDA is also looking, and I'm sure DEA is part of that discussion, is looking at what FDA can require of practitioners who are going to prescribe certain kinds of medications that are more prone to being abused. So there is work going on about that, and again, a lot more we could say, but just so you know that we do think that's a big issue.
And I'd like to add from a law enforcement perspective, when we're looking at, who are we ending up arresting because they are supplying pills to kids and pills to the community. A number of our cases actually track back to doctors. But we see two things. We see there are doctors that are pushing these pills because of their own addiction, but there are some that are selling scripts for money, and it's personal profit, and it's all about greed. But there's another set that opened our eyes to the fact that we need to do more, all of our agencies, on whatever we can do to educate doctors on the prescription drug problem, because we have pharmaceutical companies bombarding them with information on new drugs all the time, but we don't have that same coming in the other door to educate them on the dangers of these. So we have all been working together on that.
On my right.
Hello, my name is Doria, and I'm from a small rural coalition in Princeton, Illinois. I have a question that I think would best be answered by Ms. Leonhardt. We have just undertaken an ongoing permanent prescription take-back program. We have law enforcement that are working very close with us, and everything is so successful that we are basically overflowing with drugs for disposal. The law enforcement have asked us to come here and ask you some questions about, is there best practices for disposing of pharmaceuticals? Are there incineration companies across the country? Do we have a directory that we could work with? We would just like more information about costs per disposal, or how to dispose if you're going to incinerate, and any guidance you could give would be appreciated.
Sure, that's a very good question, and we were worried when we had the national take back on September 25th. There's a cost here when it comes to destruction, proper destruction, incineration of these drugs. Anybody that participated in that national take-back, DEA transported, and at DEA expense, disposed of all those drugs. We will do the same thing in April, on April 30th. So if that has been a problem for you, you may want to take your local take-back program and partner with us with the April 30th take-back, and we will pay for disposal. Last month, there was a public hearing held here in Washington because of a great law that was just passed that is going to allow the Attorney General and DEA to come up with the best practices for disposal. The law previously prevented anybody except law enforcement from taking drugs from someone who had been prescribed them. You couldn't just drop them off at your pharmacy and return them or bring them back to your doctor. That has been taken care of in a new law that just passed. The public hearing was to hear from you, and we had over 160 people testify about what they found were the best ways to safely dispose of this and safely take these drugs on a take-back. So we're going to turn those around and give out best practices, and eventually there will be no need for take-back programs. There will be no need for a national take-back program because you will have a safe, effective way for people to turn in their drugs 24/7.
Ms. Leonhardt, and I'm going to get a Twitter question right after this, but excuse my ignorance. Why can't you just take the damn things and throw them and start a fire in your backyard and burn them up? Is there some toxic thing? Why not just burn them up?
Unfortunately, that used to be some of the guidance. They used to say, well, just get rid of it on your own. But what we learned is people were told for years, flush them down the toilet. But what happened? We started testing water, and we saw that those were getting in the water, our water systems. We started seeing that it's getting into our lakes and our streams. So that is why take-back is best. And we are trying to find alternatives so that a person won't just throw them in the trash, where someone addicted to pills, they dumpster dive looking for your pills. So that was a very good question, and we're hoping through this new law to be able to have best practices. There will be no reason for anybody to throw out drugs anymore.
Okay. Our time is limited, so we want to move as quickly as we can now. There is a Twitter question for anyone on the panel who wants to answer it. You see it in front of you. Unfortunately, prescription drug abuse also happens with the senior population. Are there any initiatives planned to reach them?
Real quickly, we're working with the Area Agency on Aging to see whether or not, we have very little dollars in this area, but we're trying to see if we can utilize some of our dollars and use their senior center across the country to do some public messaging about prescription drug issues, which we think we can get a whole lot bigger bang for the buck that way, just in terms of the message about prescription drug abuse. So that's one small initiative.
So the answer is yes, there are initiatives planned. On my left.
Yes, Brent from Missoula, Montana. Thank you all for your service. We're a medical marijuana state, and locally we've seen a huge increase in the use of marijuana from our teens. Most of them report that it is medical marijuana. Recently, we've had 2 huge busts, medical marijuana providers providing illicit drugs or having as much as double the amount of plants. They've been breaking, these are felony federal levels. I have talked with numerous federal agents as well as local law enforcement, and they have told me that while they may build a case that the medical marijuana providers are not being prosecuted on the federal level. I'm wondering, is this true? And if so, what can we do about that?
Well, I can tell you that they are being prosecuted on the federal level. It's taken a while for us to, 13 states, and now we're up to 15 in Washington, D.C., who've passed medical marijuana. Their laws are all different. And what was happening is, once laws were passed, took a while. In California, for instance, law enforcement thought they had to be hands-off, and they could not take any action. That took many years. DEA, we were the only ones out there because it's always been against federal law. We were the only ones out there able to really take action. What has happened now, law enforcement in states that have had medical marijuana laws for quite some time know those laws. And for instance, in California, it is not state law. It does not allow a dispensary to make money off of the sale of marijuana, and that's where these kids are going. So we've worked with local law enforcement, and it's different in every state, it's different in every community, but we are leading the charge, and we are bringing federal cases all the time targeting those dispensaries that are selling to kids and that are making a profit and are not following what the state set up.
I want to, thank you, take a question from a writer, and then I'll get to this Twitter question, which is interesting. Yes.
Thank you. Good morning. My name is Patricia. I'm from New York State. And my question is, with the increased emphasis and importance of using data to drive strategic planning to address substance use, abuse, dependence, recovery, hopefully, how can data be captured and shared more uniformly among the multiple sectors in the state and community levels to measure outcomes, promote accountability, and replicate what works?
I'll take a shot at that. We, you're going to get tired of me saying this, but we have these 8 strategic initiatives, and one of them is data, outcomes, and quality. And we are actually really trying hard to look at what the entire government, federal government, is trying to do about transparency of data. We're trying to work with our partners, both within HHS and elsewhere, to try to get data sets and other things that we have already out there for people. And then we also have another difficulty, which is some of our data is valid at the federal or national level, but not so valid or not so able to be done at the community level because the ends get small, or frankly, you start to be able to identify people in rural areas or other things. So we have some initiatives about that. at least in my shop, some of that is dependent on dollars, and since we have continuing resolutions and crazy things that aren't happening about money, that's a little difficult. But know that we are working on that issue. We're also looking very hard at things like our block grant applications and things like that, about making some of those decisions in that process for spending those dollars to be very data-driven. So, for example, we are going to increasingly ask states to tell us why they pick one community over another to fund for a particular thing based on high risk or high need, and that's going to require some data to do that. So both on the outcome side as well as on the making it available to you all side, as well as the use of the data for decision making going forward, we're trying to address a lot of those issues.
Thank you, and I think it's an important area where we can collaborate with a purpose.
Thank you. Twitter question, which I think is interesting. With the focus on academics now in our schools, how can we get drug prevention taught in schools? Mr. Jennings, I guess?
Look, this is America. What gets measured is what gets done. There's a reason why schools are obsessed with their reading and math scores, because it gets measured and it gets reported publicly. The whole strategy behind safe and supportive schools is to raise these issues to the same level as reading and math. There will be scores. There will be scores, and they will be reported publicly. And I've staked my career on this, and I'm not worried because I know I'm right. You know what you're going to find out? The schools with the worst academics are also the schools with the worst safe and supportive scores. The woman who asked the question earlier, I don't know that we fully answered, but basically how we have responded to academic problems is what we call drill and kill. We basically just drill the kids on how to take the test. And guess what? It doesn't work. What the secretary found when he was superintendent of Chicago, they did a form of this student survey system. And what they found was that in every single school in which they had poor school climates, they were unable to get the reading and math scores up. So what we're going to be able to prove going forward is that unless you address these issues, you can't achieve academic progress. And we will have numbers to prove it. That, I think, has been the missing link in our efforts for the 25 years of the existence of the Safe and Drug-Free School program. We have relied on people believing there's a link. Now we will be able to show there is a link. And we will have the same level of rigor around school climate measurement that we have around reading and math. And I think that's what's going to change the game and get people to realize that some of these issues that they think of as non-academic, such as drug and alcohol prevention, bullying prevention, et cetera, are essential to increasing academic outcomes.
Thank you, sir. On my left.
Good morning. I work with Middleborough Youth Advocates, and we are about 40 minutes south of Boston, and we are a DFC recipient in our 4th year. We have found that we have a great relationship finally with our high school, and what we're finding our new challenge is we are being used as a resource. The school is being really overwhelmed with parents that have children that have substance abuse or addiction problems. And as a prevention agency, we're not funded to do recovery, but we're finding ourselves kind of being thrust into the recovery effort. And we're going to do it because we're not going to let these kids fall by the wayside. My concern is we don't have enough adolescent rehabs in our area. There's plenty of adult rehabs, and there's plenty of adult psychiatry personnel that will take on, the prescriptive purpose, but we don't know really how to get a adolescent rehab into southeastern Massachusetts, which would also cover the Cape and the islands. And how do you do that with no budget?
Wow. Anybody brave enough to take that?
How you do that with no budget is the trick. I don't have a simple answer to that. I have a whiny answer, which is every state in this country has seen a loss in service and treatment dollars for substance abuse and mental health over the last few years. We know of about 500 to 700 million of those dollars. Some of our partners at the associations who work with us tell us it may be as high as $2 billion lost over the 50 states and plus the territories. We think that's going to get worse before it gets better. Now, the one thing that we have, though, coming toward us is 2014, and coming toward 2014 is more people being eligible for services through Medicaid and through other health insurance capacity. The reason that's important is because sometimes that is one of the funding streams for some of those efforts. Unfortunately, it means that substance abuse providers, mental health providers, and others have to have what we refer to as the plumbing to do the billing and the capacity to get those dollars. So it's not like it's a budget, here, go build a program. It is more of a how do you bill those things. So we're doing a lot of work in SAMHSA at working with our state and local partners to try to help build capacity with providers, help states think about how to relate to their Medicaid agencies and exchanges and other kinds of things. So this issue of what's happening over the next 2 or 3 years about that is a big deal. In the meantime, I think there are people who can help individual situations. Happy to chat with you afterwards, maybe.
Thank you. On my right here.
Okay, I'm Carol Comfer. I'm a professor at the University of Utah and a former director of the Center for Substance Abuse Prevention until 2000. And I have a question. I'm here actually on behalf of the Salt Lake City Mayor's Coalition that's doing great work there. I have a question for all of you, and that is that what we saw in the mid-90s was a huge upswing in alcohol and drug abuse in kids, and it's happening again. It's starting again. What helped us to bring down, I think, those rates was a dedication to really getting the message out to parents that you matter. It's not all teen influence. It's not peer influence only. It's parent influence. And what we see now in the statistics is that parents with the economic downturn are spending less time with their kids, and we're again getting an upswing in alcohol and drug use. So this is an issue for all of you. For education, if parents aren't working with their kids, for criminal justice, and for the alcohol and drug field, that it is going up, and the parents are not getting the message like they used to with Parents the Anti-Drug Media Campaign. And also, I was able to get millions from Congress to fund 150 community coalitions and agencies to do effective parenting and family programs. We know that effective parenting and family programs are 9 times as effective as any youth-only program in the school for alcohol and drug prevention. So what can any of you do to get more money out and more effective parenting and family programs out to communities? Because I don't see it happening like it used to. OJJDP used to fund the website for all of the 35 best parenting and family programs that are evidence-based. They don't do that anymore. I'm not seeing special money going out to help community coalitions to bring evidence-based parenting and family programs.
So the question is, from where is the funding coming? Is there funding coming?
Is there going to be any emphasis on improving, nurturing parenting?
Okay,
because it also ties in with behavioral health.
Those are 2 very different questions, money and emphasis. In terms of money, I think all of us who are political appointees wish that we had served in an administration where there was 4% unemployment and a budget surplus. That unfortunately is not the hand we've been dealt. So new money? No. Let's be blunt. I'm sure you all are watching Jim on the evening news, and you see the same stories we do, which is that we're looking at a future of less resources, not more. That doesn't mean that we can't have a different emphasis. One of the things I neglected to talk about in the Safe and Supportive Schools is it's not just surveys of the kids, it is surveys of their families and surveys of the school staff as well. So it's a 3-part system. And one of the things that we know in education is that kids with engaged parents do better in school, period. There's nothing unique to the drug abuse issue around what you've just described. Kids with engaged parents just do better. They have better health, they have better academic outcomes, they have less substance use, period. We have never actually looked at which schools are having the biggest problems with parental engagement in a systematic way before. That is another part of safe and supportive schools. Because if the parents are not engaged, the school is going to struggle and the kids are going to struggle. So what we're going to have to do, I just want to give you advice that there's no one sitting on this panel who doesn't wish we had more money. And there's no one on this panel who has more money. So we cannot talk in those terms. What we have to talk about is within existing programs we have, like Safe and Supportive Schools, how do we make sure the emphasis is on all the important things like student engagement, parent engagement, and staff engagement? Because there's not going to be new money, but that doesn't mean we can't do new things with the money we have.
Yeah, and however, the one thing we do have is an administration that's really willing to talk together, and what we realize is we've got a campaign for parents, NIDA has a campaign for parents, ONDCP has a different campaign, education has a different campaign. We're all trying to talk a little bit about how we can do something better with each one of those little things. They're all small, but we all have that emphasis and effort, and the issue is how to make those dollars work better.
And from DEA, I'll add, I mentioned it earlier about our websites, one for teens, one for parents. Go to our newly revamped www.getsmartaboutdrugs.com. It's all for parents. It's kept up to date. It is a great, links to many of you. It's a great resource for parents that doesn't cost you anything.
We're going to take one more question, and then there's some information that will be useful and helpful to you in terms of others who may have some questions. But over on my left, please.
Thank you. My name is Lynn Widdowson. I'm with the Capital School District in Dover, Delaware. And as a recipient of the Race to the Top money, Delaware and Tennessee, the emphasis on reducing the dropout rate, increasing the graduation rate, and increasing attendance of students, and of course their scores, academics. There was no mention of the barriers which we're talking about, substance abuse, mental health abuse, and in the reauthorization of No Child Left Behind. Can we get all of that back in those education initiatives to help our students? Barriers, they can't learn with these barriers.
First of all, I agree completely with what you're saying there. And I do have to have a little bit of a respectful disagreement, though. In Invitational Priorities 4 and 6 in Race to the Top, there was explicit mention of addressing school climate. States were not required to do it, but they were encouraged to do it, and the states that didn't do it chose not to do it. Not because the feds told them not to. The feds were encouraging them to do it. I also think Tennessee has gotten one of the first Safe and Supportive Schools grants, and they are actually integrating Safe and Supportive Schools into their Race to the Top program. So I think one of the things is that, and hopefully I don't sound defensive, but sometimes there is a strong bias at the federal level against us telling states what they have to do in education. You know, as you probably know, 92% out of every education dollar is funded by your local and state taxes, and local and state authorities do not like when feds come in and say, thou shalt do X or Y, because they're like, you're only paying 8 cents on the dollar. Who are you to tell us what to do? So what we do a lot is we have priorities that encourage people to do things, but in the end, the ultimate decision does get made at the state and local level. We are doing everything we can to lead the horses to the water. In the end, they have to choose to drink it. And I'm very happy that actually Tennessee has also chosen to participate in Safe and Supportive Schools as well as Race to the Top, and they are seeking, I'm going to Tennessee tomorrow, that's why I know this, they are seeking to integrate those two programs, and I bet you as a result, Tennessee will get better results.
Ladies and gentlemen, thank you very much. Hold on for a second, because there's some information that you need here. I need to say this. I am delighted that I have been invited to just share a couple of minutes with you today. I have learned something. I hope you have too. I love being around people who are smart and passionate and committed to something that matters for the greater good. And I feel enlarged for having been in your company today. Your questions were wonderful. And I, again, am grateful for having been invited here. Hold on a second, though, because there's some information that you need to know. Come on,
Well, Jim invited you all to participate, and participate you did. There were plenty of people who were left with questions. So we're inviting you to make sure that you either turn those questions in to CADCA at the information desk, to any CADCA staff person, or at registration. We'll make sure we will communicate with the appropriate agencies and answer those questions and post them to the CADCA website. Along with me, let's thank our panelists for their presentations. And not just for speaking on behalf of their agencies, but for sharing themselves personally with us today as public citizens. Thank you. And absolutely, I want you all to thank with me Jim Vance for the style, for his charisma, for sharing a little bit of himself with us today. And just maybe, as he's getting it on tonight with his audience at 6 and 11, he might drop a line about where he was today and what you're up to. And what you're up to. Thank you all so much. Geraldine, you want to say anything? We want to make sure that you go to your workshops and be back for lunch for our exciting awards luncheon, which is going to be an incredible experience. And we look forward to seeing you at the luncheon, at the workshops this afternoon, and back again next year. Thanks for your participation. Have a great day.